Graphic medicine, a term first used by British physician and cartoonist Ian Williams, sits at the crossroads of comics and healthcare. But here is the problem. Most scholarship in this field has focused almost entirely on works from North America and Western Europe. Foundational texts like the Graphic Medicine Manifesto and countless academic articles routinely privilege Western creators such as Justin Green or Brian Weiss. This focus on the global north risks presenting a Euro American version of the universal patient as if it represents everyone's experience. To challenge this imbalance, we turn to the idea of provincializing developed by scholar Deebesh Chakrabarti. Provincializing means repositioning Western models as just one set of local practices among many, rather than the universal standard. When we apply this to graphic medicine, we start examining narratives from India with their own cultural, linguistic, and social complexities. By doing this, we move past Western individualist approaches to explore how visual health communication works across different local contexts. We discover unique health issues, indigenous visual traditions, distinct ways of circulating stories, and culturally specific ways of understanding health and illness. To understand Indian graphic medicine, we must first recognize that visual storytelling in South Asia did not begin with modern comic books. India has a deep visual heritage that long predates Western print imports. Indigenous sequential narrative forms include temple phrases and relief carvings that tell stories through images. Scroll painting traditions such Pathachitra in West Bengal and Path in Rajasthan use sequential panels to narrate epics and folk tales. Traditional Yogasana charts served as instructional diagrams for health practices. In the 20th century, modern commercial comics flourished through popular series like Pran Kumar Sharma's Chacha Chaudhary, Pauladi Singh, Amar Chitra Kada, and Tingle. While these mid century works focus mainly on mythology, folklore, and adventure, the 1990s marked a crucial shift. Arijit Sen's River of Stories, published in 1994, often considered the first Indian graphic novel, addressed political displacement, ecology, and social justice. Over the last 2 decades, Indian graphic narratives have tackled systemic issues including caste inequality, gender violence, and health. When we examine Indian graphic medicine, we find four main overlapping areas: public health comics, educational comics, science communication, and personal illness narratives. Each area offers unique insights into how visual storytelling can address health challenges in the Indian context. Public health comics in India personalize policy issues and emphasize collective responsibility. In a country with dense populations, significant sanitation challenges, and widespread health misinformation, proactive risk communication becomes essential. These comics reach people where they are, using familiar visual languages to convey important health messages. A prime example is Dettol Superhero, created through a partnership between Dettol's Banega Swasth India campaign and Diamond Comics. Drawing on popular superhero conventions, the comic features a hygiene hero educating children about hygiene and sanitation. Rather than focusing purely on individual biomedical diagnosis, this comic frames hygiene as a social and moral duty within everyday spaces like crowded street markets and schoolyards. It is circulated free of charge through corporate social responsibility initiatives, digital platforms, and school outreach programs. The goal is mass compliance and community risk mitigation. This strategy proved especially vital during the COVID-19 pandemic. Nagaraj Strikes, the attack of Corona Man from Raj Comics, used a famous comic hero to promote WHO guidelines and civic duty. Kids, Vayu, and Corona, developed by the Indian government and PGIMER Chandigarh, featured the Himalayan hero Vayu dispelling viral myths for children. Priya's Mask incorporated augmented reality to pair India's first female anti-violence superhero with UNICEF's Meena to fight pandemic misinformation and combat stigma around health workers. These examples show how familiar characters can carry important health and health messages to wide audiences. Educational comics act as intermediaries that translate complex or taboo subjects into accessible visual dialogues. They often function as proxy texts that step in where formal school curricula and family conversations fall silent due to cultural shame. This role is particularly important in Indian society where certain topics remain difficult to discuss openly. Consider menstrual and reproductive health. A landmark contribution in this domain is Menstruopedia comic created by Aditi Gupta and Tuhin Paul. In South Asia, deep-seated cultural and religious taboos often frame menstruation as impure, imposing spatial exclusions and social isolation on young men. Menstruopedia confronts these exact cultural taboos through characters like Priya Didi, an elder sister figure who explains female anatomy, menstrual hygiene, and self care. By blending professionally vetted biomedical facts with conversational pedagogy, it counters systemic shame and rejects reductive clinical models. Other key sex education texts include Tarshi's The Red Book, The Yellow Book, and The Blue Book, which offer youth centered education on bodily autonomy and reproductive health. Mental health represents another crucial area for educational comics, with over 80% of mental health patients in India lacking timely psychiatric care due to pervasive social stigma or notions of comic reproduction. Graphic narratives offer important interventions. Super Commando Durva, the struggle with depression, features Raj Comics' mainstream superhero spiraling into severe self doubt and clinical depression, sending a clear message that anyone can struggle with mental health and seeking professional help is a sign of strength. Digital and web comic platforms like Maunika Tatta's Doodle Drama series, Sonaksha Iyengar's A to Z of Mental Health, and Ishita Meher's What Helped Me During Depression utilize accessible social media channels to highlight lived experiences, daily coping strategies, and support systems. While educational comics focus on broad awareness, science communication comics handle specialized technical depth. In India, this field has developed unique pedagogical forms. Sign Toons, pioneered by scientist Dr. Pradeep K. Srivastava, or specialized single panel visuals designed to convey scientific research through humor. Structurally, they feature an explanatory scientific text box on one side, a central cartoon in the middle, and humorous punchline at the bottom. For instance, his cartoon Ginger and a Nossen uses a light-hearted family scenario to explain the pharmacological efficacy of ginger during chemotherapy or post-operative recovery. Graphic research and essays represent another important form. Artists like Arga Manna, a former cancer researcher, bridge academic science and history through sequential art. Works like Cafe Myth Busting, The Neuroscience of Mental Health Disorders, present complex genetic and environmental interactions as casual conversations. Manna's collaboration with MIT fluid dynamics experts resulted in Be Aware of Droplets and Bubbles, a graphic essay explaining viral particle transmission published in the Annals of Internal Medicine. Medical illustrators like Tejaswani Padma utilize versatile aesthetic styles to visualize detailed anatomical processes like neural networks, myocardium function, and tissue wound healing. Finally, graphic pathographies, book-length visual memoirs of illness, reclaim patient agency from rigid medical institutions. While prose illness memoirs are well established in India, graphic pathography is rapidly emerging. A significant example is To Cancer with Love, adapted from Neelam Kumar's prose memoir and illustrated by Movix, documenting her journey as a single mother, surviving breast cancer twice. The text uses her alter ego, Carol, to process grief, treatment, and healing. Crucially, the work seeks to deglamorize, demystify, and demonetize the female breast, shifting cultural perceptions away from objectification toward recognizing breasts as anatomical body parts requiring proper medical care and early screening. Examining graphic medicine through Indian narratives forces us to expand our definition of what comics can do. Indian graphic medical narratives demonstrate that health humanities cannot rely solely on Western concepts of individual illness memoirs. Instead, Indian graphic medicine operates across a diverse landscape. It addresses localized public health imperatives through corporate, digital, and grassroots circulation. It uses relatable cultural icons and humor to break silence around deeply entrenched social taboos. It combines indigenous storytelling traditions with contemporary digital media. As David Lewis suggests, moving beyond a global north monopoly allows us to build a true global guild, a transnational network where local cultural identity is preserved while enriching the global understanding of human health, caregiving, and bodily experience. By provincializing graphic medicine, we do not reject Western contributions but place them in proper perspective alongside diverse voices from around the world. This inclusive approach makes the field richer, more accurate, and more useful for everyone.